Hello everybody and welcome back to my vlog, and obviously I haven't had a haircut yet because I'm doing it on the same day today. So today I'm going to talk to you about acne scars and treating them with filler. And this is kind of an area of expertise for me, and it's something that I've become quite well known for. So I'm going to talk to you today about the way that I do it. So that doesn't mean that there aren't other ways, and that's really important. But certainly the ways that I have developed over the years, and I've been doing acne scars now for about 7 years, to get the best results are what I'm going to describe to you today. Now, when I see people with acne scars, usually they have really run the gamut of treatments and spent a fortune. They've had pills, they've had all sorts of different lasers, some of them really debilitating and all of them very expensive. And much of the time it hasn't really made any difference to their scars. I see as many men as women. They do present with different types of scars. And I'd say men are probably slightly easier to treat because of their scar type, but usually I can bring some improvement to everyone. And the one thing I don't do is treat people if I'm not absolutely sure in my mind I can improve things. The important thing to know about acne scars is I can never give you normal skin again because it's scarred, it's a different structure, it's been laid down in a different way, but I can quite often improve it. And it's always important to manage expectations so that people don't think that they're going to get perfectly blemish-free skin, because they're not. That's number one. The other thing is I absolutely realise as a doctor who works as a GP that acne scarring is really, really debilitating. And I've done medical vlogs on this, and I wish GPs would refer people sooner for Accutane to stop the scarring. I would much prefer that I did not have to see people with scarring. I'd much prefer that we got it at source and treated it before the scars formed. But anyway, it is what it is. So acne scarring is really hard to treat. It's really hard, and it's not the most satisfying treatment for me to do in the clinic because the patients always leave looking worse than when they came in, which is not always the case with fillers. And that's because usually we have to do lots and lots of small injections to get where we want to go, and they get lots of swelling and they get bleeding, etc. However, it's a process, and it's very rare that I see someone with acne scars just once. It usually happens over a few weeks as we slowly get things better. So I use two different treatments for acne scars. I either use normal filler, and I normally use Restylane Classic or Restylane Refine, which is nice and soft and spreads. And I use those when the scars are slightly deeper, or I use Restylane Skin Boosters and occasionally profhilo, but usually Restylane Skin Boosters. And I probably use more Restylane Skin Boosters now than normal filler, which is a change over the years because we didn't used to have skin boosters. So it really has added to the armoury in terms of what I can achieve. So when the scars are deep, pitted, or and they don't have to be acne scars actually. So for example, scars caused by piercings in the face are quite deep and often quite dark because they fill up with debris. I use filler for those, and I literally go under the scar with the needle, and I use the needle as a subsizer. So once I'm under the scar, if there's scar tissue there that I can feel because it's tough, I actually use the needle to break it down as much as I can. So it's kind of a two-part treatment from the same needle. So some subcision underneath, and then I put the filler under the scar and it lifts it out. And quite often with those deeper scars, the result is beautiful. And it works really nicely, and it is almost instant. Chickenpox scars, for example, work really, really well with that. There's a picture on my Instagram of a guy with 3 deep pitted scars that he wanted to lift out just for his wedding. And you can see before he even leaves the clinic, the scars have lifted out, and all you can see is the redness and the needle point. I always use a needle 99% of the time for acne scarring, and I'll tell you in a minute when I don't use a needle. But that works really well. And as I've said, they don't have to be acne scars. I've lifted out lots of scars here, a couple of injuries, a burn. I've done scars on legs that were, again, injuries, trauma, scars on arms. So if it's dented in and I can lift it out with a filler, I will. And it usually works quite well. Now, obviously it's not permanent. but the subcision will help, and I don't think it'll ever go back quite as badly as it used to be. However, don't forget the skin over the scar is different. So the skin over the scar will always look different, slightly shiny perhaps, a slightly different colour, and I can't change that. But if you take out the hollow so that makeup can go over it, or it doesn't look from the side like there's an indent, that in itself is a major improvement. And as I said, you'll see some examples on the site. So then let's talk about less deep scars, superficial scars. They're harder, much harder, but they seem to be much more common, especially in women. So when the scars are really superficial, I can't put a heavy filler underneath them, because if I put it that superficial, you'll get lumps and nodules, or you'll see the filler. So you just replace one problem with another. So I use skin boosters. Now it's a longer process because we do one every 3 months for 3 months, one every month for 3 months, and then we do one 6 months later, and then we should get to the point where we just need to do one a year. And I have many patients who are at the 1 a year, even slightly longer for some, and for some slightly sooner. Some come about 9 months, but we do get to that maintenance stage, and it can make a major difference. It promotes collagen growth and it hydrates the area. That's how skin boosters work. So the act of the needle going into the dermis promotes collagen growth because it injures the fibroblasts, and the filler sits just under the dermis and hydrates and lifts out the scars. Now, you get a slightly better response and improvement each time you have one of those first 3. I've just actually done someone's entire face because they had some very bad scarring, and I deviated from my normal practice, and on the forehead, because it's a danger area because of all of the arteries and very superficial vessels, I used a cannula, and the result was good. The other interesting thing about it, we did the temples, we did the forehead, we did the cheeks. The patient had a lot of erythema, hyperpigmentation. They were very red before we started, but by the end of it that redness had gone away. So it did 2 things. It lifted out the scars by hydrating the area. I did some subcision, but also it seemed to improve the pigmentation on the skin, so that was a bonus. Now those pictures are on the Instagram site at nonsurgicalclinic.co.uk, so have a look and you'll see. It's important to know that this is a really skilled area, and not everybody does this, not everybody knows how to do it, and it's important that the practitioner who is assessing you is honest enough to say, do you know what, I can't improve those scars. So usually if you use your fingers on the skin to pull the scars out, if they respond to that pulling, then they'll respond to fillers. If there's no response, then they won't. And it's time to be honest with the patient, not interested in the money at all, and say, I'm really sorry, I can't do this. It's very rare that that happens, but sometimes it does, and I have to be honest with the patient and say, I don't think I can improve your scars. So that's important. Ask your practitioner how many of these they've done, because if they haven't done lots, then go to someone else. Have a look in the chat groups and see who's going to who, because there are only a few of us, certainly in London, who are doing it and doing it well, and you need to find somebody who is recommended by other people. And there are lots of acne forums. I think acne.org is one of them, where people talk about this kind of thing all of the time. So that's important as well. Now, when I said you come away looking worse than you went in, that's also true. Because, for example, skin boosters needs lots of injections, because we place the skin booster over the whole area. I might concentrate some skin booster in particularly deeper scars, but in the main you're covering the whole area. So you'll have swelling, you'll have lots of needle marks, and you could have bruising. And that bruising could be nothing, or almost nothing, or it could be lots. And there's no way to predict it. Is it painful? Most patients seem to tolerate it quite well. There's lidocaine in the filler, so quite quickly the area becomes numbish anyway. So we don't use numbing cream for fillers. I don't use them for any fillers, but particularly for acne scars, because numbing cream causes swelling. And if you do that before you've even started, you won't see, or I won't see, where the scars are. Also, it's important that as a practitioner I start, say, at the top and work down, so that I leave the swelling behind, and then I get to a point where there's enough swelling and it's time to stop. So that's quite important. So you need to be warned that you know that you might need some downtime, do it at a weekend, that it will take time. So acne scars probably take me longer than any other treatment, but that's fine because it's really sorting people out psychologically, and that's important. And the other thing to know is you might sometimes have a mix of scars, superficial and not quite so superficial. And I will take a judgment which one is predominant. And let's say I start with skin boosters. It might be that at the end of the treatment, I then do one treatment of the heavier filler to pick out any scars that are left. So it's a process, and it might not happen as quickly as you want it to, but at the end of the day, I can't think of an acne scar treatment that hasn't had some improvement. At the end of the day, you'll get some improvement, and that's what most acne scar sufferers want, some improvement. And they're usually quite realistic as well, that they know they're not going to get, resolution, as it were. But from that perspective, once we've gone through that process that takes time and get to the end of it, then it's really satisfying. And it's really satisfying to see people just once a year, just having a top up, but their skin looking so much better than it did when I first saw them. So that's my quick vlog on acne scars and how I do them. Other people will do them differently. I'm going to put a link to a paper that I wrote for Aesthetics magazine about acne scarring, which kind of explains everything I've just said to you in much, much greater detail. It talks really about normal fillers, because at that stage I don't think we were using skin boosters so much, but at least you get a picture for what can be done with normal fillers. If you've got any questions about acne scars, please do ask me in the comments after this vlog. Please do go and research me in the forums, because I know that lots of the patients that I've treated are in there talking about it. And please have a look at the acne scarring that I've done on Instagram, so at Non-Surgical Clinic. And I hope that's been helpful, and I hope it's made you think about something that perhaps you didn't know was a treatment for acne scars if you're a sufferer. So take care, and I'll see you next time.